Welcome to the Patient Advocacy Show. I'm Dr. Michael Warner. In this episode, I will show you how we can attack ovarian cancer with the EHR. I'll show you how to work with your medical provider and offer the proper clues that should lead to earlier detection of ovarian cancer. I'll also discuss Vice President Biden's Cancer Moonshot program that wants you to become engaged. We can show you how. Welcome back. If you saw our first episode, Inaccuracies of the Health Record, we highlighted two examples of where the patient's story was different than what was documented in the health record. We also announced the beta testing of Patient Advocacy School. This is where we teach you how to read and correct your health records. The link is available here and also on our Patient Advocacy Initiative's website and Facebook page. The training series, the audiobook, the prehistory forms, are all offered to you for free. The last show questioned the integrity of the health record. How do you know if your health record is accurate? Well, you don't unless you read it. I believe it is up to you as a consumer of healthcare to read your health record so to be sure it is accurate. You want to make sure that the written story is your story. The first step is to read your health record. The second is to contribute information. If you have a family member with ovarian cancer, breast cancer, colon cancer, or any cancer for that matter, that information should be listed in the past family social history part of the history component of your health record. If you participate in the training, you will know exactly what that means. I encourage you to learn how to represent your story and learn to describe your story in the language and style compatible with the billing and coding rules and the structure of all electronic health records. Because if you can control the accuracy of the information in your health record, then you have a better chance of receiving excellent health care. Ovarian cancer is a horrible disease. According to the American Cancer Society, it is the 5th ranking cancer among women. Every day, nearly 5,000 new cases emerge, and every day, 1,630 women die in this country due to ovarian cancer. The lifetime chance of getting ovarian cancer is 1 in 75. About half are women over age 63. It is more common in white women than African American women. The risk goes up with age and is rare in women under age 40. Risks decrease if a woman has had a baby before turning age 26. The risk further lowers for each additional child. Breastfeeding has been found to also lower the risk of ovarian cancer. The risk of developing ovarian cancer also decreases if a woman has taken a birth control pill for as little as 3 to 6 months. This lower risk continues for years after no longer taking the pill. Increased risks are associated with being obese, taking medications such as fertility drugs, androgens, which are male hormones, and estrogen after menopause. Having one or more family members with ovarian cancer dramatically increases a woman's risk of developing the disease. The risk goes up even if someone on your father's side has or had ovarian cancer. If a mother, sister, or daughter has or had ovarian cancer, you want to pay special attention to how you feel and be on guard for the symptoms. The risk of getting ovarian cancer also increases if anyone in your family has a history of breast or colorectal cancer. You may have heard about genetic mutations at genes BRCA1 and BRCA2. When these genes function normally, proteins are made that prevent abnormal cell growth. These proteins act as tumor suppressors. When the genes are defective, then the proteins do not work well and increase the risk of ovarian cancer. These particular genetic mutations also increase the risk of breast cancer. A BRCA1 mutation gives a lifetime ovarian cancer risk of up to 70%. A BRCA2 mutation gives up to 30% risk by age 70. Remember, when we said ovarian cancer occurs in 1 in 75 women, now we're talking about 30 to 70 out of 100. If you have breast cancer and are positive for BRCA1 and BRCA2 genetic mutations, then you have a much higher risk of ovarian cancer. Some women pay for genetic testing and based on positive results and genetic counseling, elect to have their ovaries and breasts removed. While these genetic tests do not offer all the answers, as it is not as simple as BRCA1 and BRCA2, new discoveries promise to further unravel the genetic mystery of cancer. It's coming. One of the major problems with ovarian cancer now is our lack of early detection. A blood test known as a CA-125 is often positive when somebody has ovarian cancer, particularly if it is an epithelial ovarian carcinoma, which is one of the most common types. When ovarian cancer is present, CA-125 is helpful to monitor the effectiveness of treatment. The stability, rise, or fall of the CA-125 level gives an indication of how treatment is working. Sadly, CA-125 is not elevated by all types of ovarian cancer. In addition, CA-125 elevation can happen naturally. Normal ovarian, pancreatic, and breast cells and the cells that line the inside of your chest and abdomen naturally produce low levels of CA-125 into the blood. Sometimes the level rises, but has no relation to cancer. Worse yet, the test is not always elevated if cancer is present. Normal CA-125 levels are found in about half of patients with stage 1 ovarian cancer. Imaging studies such as ultrasound, CAT scan, and MRI can all be used to detect ovarian cancer, but have not been found to be good screening tools. Early discovery and treatment is important because one counts on the other. If found and treated at stage 1, the survival rate is 92%. Unfortunately, only a small amount of cases are found at this stage. At stage 4, the survival rate drops to 17%. Because ovarian cancer is often found late, the overall 5-year relative survival rate for ovarian cancer is only 45%. So what do we do? Certainly, we need new advances. We need a screening blood test that can tell us if ovarian cancer develops. Of interest, victims of ovarian cancer share similar stories. Early symptoms of ovarian cancer can include bloating, pelvic or abdominal pain, trouble eating or feeling full quickly. Also on the list is urinary urgency, feeling like you have to urinate, and frequency, having to urinate often. From our last episode, you can guess that if you express these concerns to Dr. Holloway, none of these symptoms would be documented into the health record. You could explain your story in detail, and the note would probably read, "Everything is okay." Consider the hospital case presentation, a topic in our last episode where the patient's story, as told by the patient on stage, was compared to a different story as documented in the electronic health record. You can bet that if the patient had ovarian cancer, she likely expressed many symptoms, but none or few of them were recorded in a record. The pattern and persistence of her problems, after all, can only be evident if they are documented. This patient's record likely noted no problems or no complaints, despite what she verbally expressed at medical encounters. Patients with ovarian cancer experience some or all of these vague symptoms, but these problems persist and represent a change from normal. It is important that such complaints and concerns are documented in the health record. If properly recorded, then the health record can describe a pattern that can be recognized by your medical provider and soon be detected by the computer. Imagine if a woman sought medical attention 3 times in a span of 6 weeks. Once for bloating, another visit for feeling full, another time for urinary frequency. If not documented and reviewed, each episode could look innocent. Bloating, eat more fiber. Next visit, feeling full, don't eat before bed. Next visit, urinary frequency, your urine looks fine, there's no evidence of infection, must be age. Each of these recommendations may be sound. At some point, however, we need to ask the patient, you are here today for urinary frequency. Do you still experience bloating and feeling full? If the patient says yes, and she has 2 relatives with ovarian cancer, it is time to consider the possibility of ovarian cancer in this patient. As ovarian cancer continues to advance, the symptoms progress and can include fatigue, upset stomach, back pain, pain during sex, constipation, menstrual changes, abdominal swelling, and weight loss. Many of these symptoms can occur from time to time in any woman. Many of us of any gender experience occasional constipation, upset stomach, and urinary urgency, but for the person with ovarian cancer, these problems persist and do not get better. These women do not feel normal. If the medical provider documents these symptoms in the health record, then a pattern may emerge. It is only a matter of time until data analytics allow for the data mining of the patient's story as recorded in the electronic health record. Keep in mind, with working with an EHR, you are working with a computer. Computers can easily be programmed to search for all the details in patient stories, analyze what happens, and give us answers. Okay, so we know that ovarian cancer begins and progresses with many vague symptoms. But tell me more. Is there a special pattern of presentation of symptoms that is associated with each subtype of ovarian cancer? Answers to this type of questioning will lead to faster diagnosis and better treatment. Do we have the ability to individualize care? For example, if you are a 64-year-old female with hypothyroidism and low vitamin D, does that have any bearing on ovarian cancer treatment? You can replace that medical problem list with any combination of diseases. I am sure that we will find the results to be fascinating and enlightening. How about those of us who take medications? Will a medication or a list of medications influence ovarian cancer diagnosis and treatment? We can get these answers. Most of our medical records are digitalized in electronic health records. All we need to do is input quality data and then analyze. When it comes to medical decision-making and shared decision-making, the details from health record data analysis will help guide patients and providers to working together to assess what is going on and choose what needs to be done next. This is all coming. We do not need to invent computers. Universities are graduating class after class of bright young people who grew up with data and digital devices. They will help us figure it out. In our training video, we explain the details of documentation rules. If a doctor were audited by an insurance company or the government, then these are the rules that would be applied. We will teach you how to understand the rules so you can understand your own health record. Part of the history component of a documented medical encounter is the past family social history. If you have a history of cancer in your family, this is where it goes. Once entered into the specific area in the electronic health record, note, the information should repopulate in any future office, emergency room, or hospital encounter. You do not need to offer the same facts every time you seek medical attention. Properly documented, this information will help any medical provider who reads your health record and participates in your care. To ensure that your health record is accurate, we suggest you look at your record before and after every medical encounter. Review before to acknowledge what was addressed last time and prepare for any upcoming visits with your health provider. Reviewing your record after a medical encounter allows you to be sure that your story is properly documented. The Cancer Moonshot initiative was announced by President Barack Obama during his January 12, 2016 State of the Union address. At the end of his address, President Obama asked Vice President Joe Biden to head a new national effort to end cancer as we know it. The goal is to make a decade worth of advances in cancer prevention, diagnosis, and treatment in 5 years. Experts want to share information about the type of cancer and how it responds to treatment. They also want to link genetic data with clinical data, meaning they want to know more about you. They want you to be engaged. In our last episode, we discovered what it was like to review instances of health records without accuracy. Those records had nothing or little to do with the patient. Worse yet, they provide misleading data regarding the health of our population. The Vice President's Cancer Moonshot needs accurate data. If you, as a consumer and patient of healthcare, supply details and assure that your health record is accurate, then you will help achieve and exceed the Moonshot goals. While the Moonshot project will unleash new discoveries over the next 5 years, improving your health record promises to improve your healthcare now. If we improve the accuracy and content of the health record, I predict that the detection of ovarian cancer will improve. As we all learn to express our story and have it accurately documented in the health record, we will improve all aspects of healthcare. It all starts with you. Yes, we have challenges. We have adopted electronic health records in a digital age, but have used EHRs as if it's a paper replacement. It's time to treat EHRs like a program on a computer. In our training video, we express the old mindset and explore a new way of looking at healthcare, one where you and your provider are partners in health, one where you contribute to the betterment of your health and engage in the process. Our nonprofit's first mission is to improve the accuracy and content of your health record. I invite you to participate in the beta testing of Patient Advocacy School. Please follow this link to enroll. You need to enter a first and a last name. I ask that you please make up a unique first name and enter your zip code as the last name. Please remember these names because we will not know who you are or what name you have chosen. In future episodes, I hope to share observations from our beta testing as well as review comments posted about this show. Patient advocates, let's rise to the challenge of improving the information in our health records. Let's document our family history. Let's express our stories so they can be heard and understood. Let's allow the clues of ovarian cancer to be properly documented in our health record so that we can discover cancer faster than ever before. Let's allow data analysis of electronic health records to help us detect and track our attack on ovarian cancer. The details are in your story. For those being treated for ovarian cancer, I know you are going through a lot. You may be hurting, you may be struggling, you may be vulnerable. My prayers are with you. We need your help. Your story measures the human response to current treatment. Your story, along with the story of other women with ovarian cancer, can tell us what is working and what isn't. Your words can guide us to solutions. I encourage you to check your health records for accuracy and tell your story so it can be documented in the electronic health record. We need to value the history, the subjective story of the patient, as a valuable source of information. Let's attack ovarian cancer with the EHR. Let's start, but not end with ovarian cancer. Let's help the Moonshot blast off. See you in the next episode. Best of health to you and your family. I'm Dr. Michael Warner.